Assalamu alaikum wa rahmatullahi wa barakatuh. This is the first lecture about diabetes mellitus that we are going to take today. We start by knowing what is diabetes mellitus. Diabetes mellitus is simply defined as a group of metabolic disorders that's characterized by hyperglycemia. This hyperglycemia occurs either due to absolute, complete abscess of insulin secretion. This is what happens in type 1 diabetes, or a relative or impaired insulin secretion with or without insulin resistance. This is what occurs in type 2 diabetes. The insulin deficiency that we are talking about, or absence, will cause a global problem in metabolism of the body. That includes carbohydrates, lipids, proteins, water, and electrolyte disturbance. Clinical physiology of glucose metabolism. Glucose in the body is closely controlled and regulated and maintained with a narrow range of differences to ensure a continuous supply of fuel or energy, which is glucose, to the body cells. The most important organ that needs glucose in the body is the brain. The brain cannot store glycogen or lipids as a source of energy. Therefore, glucose will pass blood-brain barrier and give energy to the nervous cells. What happens to glucose after you ingest a diet of carbohydrates? Insulin will be secreted from the Langerhans cells that are called beta cells. That is present in what is called Langerhans Iceland. This insulin will reach the portal circulation and start to have effect on the body to maintain the glucose. The function of insulin is to suppress hepatic glucose production, stimulate of hepatic glucose uptake, stimulate glucose uptake by peripheral tissue as muscles and lipids. The other most important hormone that take part in the metabolism of glucose is a hormone called glucagon. Glucagon is also secreted from the pancreas, but from cells called the alpha cells. It will reach the portal circulation in response to decrease in blood glucose due to the effect of insulin. So it will counteract the action of insulin. The function of glucagon is gluconeogenesis. That is the process of producing glucose from non-carbohydrates sources as proteins, muscles, and lipid fat tissue. Glycogenolysis, and that is the breakdown of glycogen that is stored in the liver. Other factors that play a role in the metabolism of glucose and the secretion of insulins are amino acids and hormones that are present in the gut. An example of that is glucagon-like peptide, GLP-1, and gastric inhibitory polypeptide, GIP. Classification of diabetes. Diabetes can be classified according to the etiology into number 1, type 1 diabetes, number 2, type 2 diabetes, number 3, secondary and other specific types, which are A. Genetic defects of beta cell function. An example for that is monogenic diabetes mellitus or maturity onset diabetes of the young, that is nicked by moody diabetes. B. Pancreatic disease. Any disease of the pancreas that will affect the beta cells will lead to secondary diabetes. C. Excess endogenous production of hormonal antagonists to insulin. An example for that are endocrinopathies, as Cushing disease or syndrome, etc. D. Drugs. A simple example for that are steroids. E. Associated with genetic syndromes that will be mentioned later on in other lectures. The fourth example or type of diabetes that should be mentioned is gestational diabetes. Now we are going to speak briefly about type 1 diabetes. It constitutes 10 to 15% of all diabetes in the world. Its pathology is due to complete destruction of insulin secreting beta cells that we mentioned before in the pancreatic islets of Langerhans, leading to total or absolute insulin deficiency. What is important to know about diabetes type 1 is that its symptoms occurs acutely. This is very important to differentiate it from type 2 that takes a longer time to be noticed or diagnosed. Type 1 diabetes is associated with other autoimmune diseases. An example for that, thyroid disease, celiac disease, Addison disease, pernicious anemia, and vitiligo. Genetic factor in type 1 diabetes is that there should be a genetic susceptibility in the person to develop type 1, but they usually don't have a first degree relative, so we can't consider it as positive family, that they have positive family history. Another cause or predisposition diabetes is environmental. An example for that, viruses that include mumps, cytomegalovirus, and Epstein-Barr virus. Children at a young age, if they develop one of these viruses, might induce or stimulate the destruction of beta cells in the islands of Langerhans. Some drugs and chemicals play a role in the destruction of beta cells. Dietary constituents as nitrosamine found in smoked and cured meats and coffee, bovine serum albumin, which is a large constituent of cow's milk, given early in infancy. The hygiene hypothesis. Hygiene hypothesis is that when a child is closely monitored, he will not develop any immune responses to protect his body. In other word, in Arabic, الاهتمام الزائد بالطفل والنظافة الزايدة والحفاظ عليه من التأثيرات الخارجية يخلي مقاومته ضعيفة، فممكن أي فيروس will induce autoimmune disease and will lead him to develop diabetes. The other important type of diabetes, which is more common and the most common type of diabetes, is type 2. It constitutes 85 to 90% all people that have diabetes in the world. It is characterized by impaired or relative insulin deficiency, with or without insulin resistance, increased hepatic production, that is above the normal in normal people, abnormal fat metabolism. Both of these 2 points are due to increased glucagon secretion to provide glucose to the body due to absolute insulin deficiency, relative insulin deficiency or insulin resistance will lead to the glucose will not reach the cells. So the cells will give a stimulus that it's hungry, it needs energy in spite of the presence of glucose in the blood, but it cannot reach it because there is no insulin. Or there will be a glucagon secretion to increase the glucose level from glucogenolysis or gluconeogenesis as mentioned previously. Genetic consolidation. The disease is known to be polygenic and multifactorial. They have strong family history, not like type 1 diabetes. So we can say they have a strong genetic components more than type 1. Environmental factors that usually play a role in the development of type 2 diabetes. Number one is age. Most of patients with type 2 diabetes are above the age of 50, so it's more common in older ages. Obesity, particularly visceral or central. Diabetes increase tenfold in people with a body mass index of more than 30 kg per square meter. Sedentary lifestyle, urbanization, unhealthy diet, economic development. All these mentioned play a role in the development of type 2 diabetes. Now we are going to speak briefly about other types of diabetes. The first example is moody diabetes, characterized by autosomal dominant inheritance, early onset of hyperglycemia, usually less than 25 years, impairment of insulin secretion due to genetic defect of beta cell. So, monogenic is a type 2 diabetes or like type 2 diabetes but occur in young age people that has impairment of insulin secretion, not absolute insulin secretion like type 1. Okay? And this is due to beta cell dysfunction, genetic beta cell dysfunction, and is inherited as autosomal dominant. The other type is LADA, which is abbreviation of latent autoimmune diabetes of adult or slow onset diabetes, and sometimes it's called type 1.5. It is a form of type 1 diabetes that occur in adults with a slower course of onset. As we mentioned in type 1, the symptoms are acute. Here they are more insidious and slower. Therefore, when they occur at an older age, middle age people, they first thought to be type 2 diabetes, and they start treatment with oral antidiabetic agents. How to differentiate it from type 2 is by sending auto antibodies against the isolate of Langerhans beta cells, and this will differentiate it from type 2. Its final treatment is by insulin. Diabetes in pregnancy, the other type of diabetes. Diabetes in pregnancy could be one of two types. Either overt diabetes, before pregnancy, patient has diabetes, either type 1 or type 2. The other type is gestational diabetes, then that is defined as diabetes that occurs for the first time during the 24th or 28th weeks of pregnancy. If early in the pregnancy the patient has diabetes, then this is not gestational diabetes, but it is over diabetes. That's to say, either type 1 or type 2. So, therefore, gestational diabetes, as we mentioned, will occur for the first time during the 24th to the 28th weeks of pregnancy. In susceptible women, not all women who get pregnant will get gestational diabetes. Only those that are susceptible, and the susceptibility will be mentioned later on. This is due to an increased tissue resistance to insulin, and it's due to hormonal that increase during pregnancy, that's to say estrogen, progesterone, and particularly human placental lactogen. Thank you very much.